Welcome to Catalyst Medweb, where we ignite understanding and make learning easier. In our today's class, we'll be looking at mediastinum, one of the important aspects of the thorax. Firstly, you should know where is the mediastinum located. You should know that the mediastinum is located at the thoracic region. And in which part of the thoracic region? The mediastinum is located at the median aspect of the thorax, in between the two lungs. Okay, from this overview, we can see that in our right side and our left side, there are presence of the pleural cavity. And in between this pleural cavity, that is where the mediastinum is located. So the mediastinum is a middle septum that is present in the thoracic cavity between the two pleural cavities that houses the lungs. Mediastinum is very important because it houses all the viscera of the thoracic cavity except the lungs. It houses the heart together with the origin of the great vessels. So from here, this is our right pleural and this is our left pleural. This pleural cavity, they are the one that houses the lungs, the right and the left lungs. Then in between this pleural is where our mediastinum is located. So all this red line here indicates our mediastinum. So this is our mediastinum. And the mediastinum is bounded anteriorly by the sternum and extend backward into the thoracic cavity. Superiorly, it is bounded by the superior thoracic aperture, and inferiorly, it is bounded by the diaphragm. At the lateral side of it, it is bounded by the mediastinal pleural. So from here, these the boundaries of the mediastinum. Superiorly here, there is superior thoracic aperture. Inferiorly here is our diaphragm. Now, anteriorly it is bounded by the sternum, and posteriorly it is bounded by the thoracic vertebra. And at the lateral aspect of it, it is bounded by the mediastinal pleural. The mediastinum is divided by an imaginary line that runs from the sternal angle anteriorly into the lower border of the fourth thoracic vertebra posteriorly, and that transverse plane line divides the mediastinum into two parts. There is superior mediastinum and the inferior mediastinum. That is about the division of the mediastinum. The mediastinum is divided into two: superior mediastinum and the inferior mediastinum by an imaginary line plane that runs from the sternal angle in front up to the lower border of the fourth thoracic vertebra. So from here, the upper part here is our superior mediastinum. The entire lower part here is our inferior mediastinum. And the inferior mediastinum is further divided into the three by the pericardium that houses the heart. There is mediastinum that is present in front of the pericardium. That one is called anterior mediastinum. The mediastinum is present at the back of the pericardium called posterior mediastinum, while by the pericardium itself forms the middle mediastinum. So from here, in front of the pericardium is the anterior mediastinum. And behind the pericardium is the posterior mediastinum. While by the pericardium itself forms the middle mediastinum. So this is about the divisions of the mediastinum. Now, I will know what are all these divisions are. Then we'll take all the divisions one by one, starting from the superior mediastinum. Now, the superior mediastinum is the upper part of the mediastinum. and it is bounded anteriorly by the mandibular sternum. It is bounded anteriorly by the mandibular of the sternum. It is bounded posteriorly by upper fourth thoracic vertebra, T1 to T4 thoracic vertebra. That is the boundary of it posteriorly, and it is bounded inferiorly by the transverse line that runs from the mid-sternum into the lower border of the fourth thoracic vertebra. So this is the boundaries of the superior mediastinum, and at the lateral aspect of it, it is bounded by the mediastinal pleura. The content of the superior mediastinum. The content of the superior mediastinum, you can easily remember them using the mnemonics PVT, left battle. Generally, these are the entire content of the superior mediastinum, where our P stands for phrenic nerve, V stands for vagus nerve, that is both right and the left, phrenic nerve, right and the left, vagus nerve. T here stands for thymus. The left stands for left laryngeal nerve. B, brachiocephalic artery and vein. T, trachea. And another T is thoracic duct. The L is our lymph node, and the E is esophagus. So these are the major contents of the superior mediastinum: the phrenic nerve, right and the left; the vagus nerve, right and the left; the thymus, the left laryngeal nerve; the brachiocephalic artery and the vein; trachea, thoracic duct, lymph node, and the esophagus. Though you can also classify them, for easy understanding, you can classify them into arteries, vein, nerve, and the lymph nodes. So into artery, for the artery, there is brachiocephalic artery, two, arc of an aorta, three, left common carotid artery, and the fourth artery you can find here is left subclavian artery. These are the arteries that you can find in the superior mediastinum: the brachiocephalic artery, the arc of an aorta, left common carotid artery, and the left subclavian artery. For the veins that you can find in the superior mediastinum, the veins are the superior vena cava, that is the upper part of the superior vena cava. You can also find brachiocephalic vein and left superior intercostal vein. Left superior intercostal vein. For the nerves that you can find in the superior mediastinum are: there is phrenic nerve, the vagus nerve, the sympathetic trunk, as well as the deep cardiac plexus. These are the nerves that you can find in the superior mediastinum: phrenic nerve, vagus nerve, sympathetic trunk, and the deep cardiac plexus. For the limbs the lymph node and the lymph vessels that you can find in the superior mediastinum are, there is thoracic duct, there is thymus, thoracic duct, the thymus, and the lymph node. There are also tubes that you can find in the superior mediastinum. The tubes are just two: the trachea and the esophagus. The last structures that you can find in the superior mediastinum are now the muscles. And there are three muscles that you can find in the superior mediastinum. There is sternocleidomastoid muscle, sternothyroid muscle, and longus colli. These are the three muscles that you can find in the superior mediastinum: the sternocleidomastoid muscle, the sternothyroid muscle, and the longus colli muscle. So these are the contents of the superior mediastinum. This diagram here is showing off some structures that we can see in the superior mediastinum. From here, this is our arc of aorta, and the arc of aorta has three branches. Here is our brachiocephalic branch of this. This left common carotid. This one here is our left subclavian artery. This trunk here is our esophagus. The one close to it is the trachea. Coming to this side, this is our brachiocephalic vein. This is our right brachiocephalic vein. This is our left brachiocephalic vein. And this is our right vagus nerve. And coming down here is our left vagus nerve. So these are the common structures that we can find in the superior mediastinum. Clinical correlation of the superior mediastinum. One of the most important clinical correlation or the significance of the superior mediastinum is that it provides potential dead space. This space is the we allow the veins to enlarge during increased blood flow. We'll be moving to anterior mediastinum. The anterior mediastinum is part of the inferior mediastinum, located in front of the pericardium, and it is bounded superiorly by the transverse thoracic plane, which runs from the sternal angle in front up to the lower border of the fourth thoracic vertebra. It is bounded inferiorly by the diaphragm, laterally by the mediastinal pleura. Anteriorly, it is bounded by the body of the sternum. Posteriorly, it is bounded by the middle mediastinum, which is formed by pericardium. So the boundaries of it is that we said boundaries of it is superiorly. It is bounded by the transverse thoracic plane, bounded inferiorly by the diaphragm. It is bounded laterally by the mediastinal pleura. Mediastinal pleura, bounded anteriorly by the body of sternum, and posteriorly by middle mediastinum. Which is formed by the pericardium. So these are the boundaries of the anterior mediastinum. Content of anterior mediastinum. The content of the anterior mediastinum can be easily remembered using the mnemonics SLTFM. You can use SLTFM to remember the content of anterior mediastinum. S here stands for sternopericardial ligament. Sternopericardial ligament. This sternopericardial ligament is the ligament that extends between the sternum and the pericardium, and there are two. There is superior sternopericardial and the inferior sternopericardial. So it's the content of anterior mediastinum. Our N here is our lymph nodes. There are 3 to 4 lymph nodes that are present in the anterior mediastinum. T here is the lower portion of the thymus. Lower portion of thymus. So you can use T to remember thymus, but the lower portion of the thymus. The F here is fat, and which of the fat? That is loose areolar tissue. Loose areolar tissue, and the M is the mediastinal branch of internal thoracic artery. So these are the contents of the anterior mediastinum. SLTFM. The sternopericardial ligament, the superior and the inferior sternopericardial ligament, the lymph nodes, the lower portion of the thymus, loose areolar tissue, as well as the mediastinal branch of internal thoracic artery are the content of the anterior mediastinum. Clinical correlation of the anterior mediastinum. Under the clinical correlation of the anterior mediastinum is that the infection of the neck can easily migrate to the anterior mediastinum through a space which is called pretracheal space. Through this space, infection of the neck can easily transmit into the anterior mediastinum. Up next will be the middle mediastinum. The middle mediastinum is the part of the inferior mediastinum, and it's the medial aspect of the inferior mediastinum. It is the one that separates the anterior mediastinum from the posterior mediastinum, and the boundaries of it is bounded superiorly by the superior mediastinum, inferiorly by the diaphragm, anteriorly by anterior mediastinum, and posteriorly by posterior mediastinum. So this is the boundaries of the middle mediastinum. Now to the content of the middle mediastinum. The content of the middle mediastinums are: 1, there is heart, pericardium, arteries, and there are different types of the artery, like there is pulmonary trunk, which gives rise to pulmonary arteries. There is also pericardiophrenic artery and the ascending aorta. These are the arteries that are in the middle mediastinum. There are veins as well. The veins are the azygous vein, but it is the terminal part of the azygous vein. There is pulmonary vein, right and the left pulmonary veins. And lastly, the vein that you can find in the middle mediastinum is the superior vena cava. But it is the lower portion of the superior vena cava, because the upper portion of the superior vena cava is found in the superior mediastinum. So superior vena cava, that is the lower portion of the superior vena cava. So these are the veins that you can find in the middle mediastinum. You can also find the lymph. The lymph that you can find in the middle mediastinums are tracheobronchial lymph node. The nerves that you can find in the middle mediastinums are, there is phrenic nerve, as well as deep cardiac plexus. These are the nerves that you can find in the middle mediastinum. There are also tubes that you can find in the, such as the bifurcation of the trachea, as well as right and left principal bronchi. So these are the contents of the middle mediastinum. From this diagram here is showing us the middle mediastinum content, some of its content. This whole part here is the heart. And from here, this two here is our right pulmonary vein. And here, this is our left pulmonary vein. This is our azygos vein, and this superior vena cava. Superior vena cava, and the pulmonary trunk. This diagram here shows the content of the middle mediastinum, and among the most common content or the most important content of the middle mediastinum is the pericardium and its contents, such as the heart and the root of the great vessels. Next one is our posterior mediastinum. The posterior mediastinum is one of the inferior mediastinum as well. It is located at the posterior aspect of the middle mediastinum that is formed by the pericardium. It is bounded superiorly by the transverse thoracic line that separates the superior mediastinum from the inferior mediastinum. Inferiorly by the diaphragm. Anteriorly by the middle mediastinum. And posteriorly by the body of lower 8 thoracic vertebra, and laterally by the mediastinal pleura. So these are the boundaries of the posterior mediastinum. Contents are, you can see there is esophagus, there is descending thoracic aorta and its branches, descending thoracic aorta and its branches, there is azygos vein, hemizygous vein, as well as accessory hemizygous vein. There is vagus nerve, also sympathetic trunk. There is also posterior mediastinal lymph node. mediastinal lymph node, and there is thoracic ducts. So these are the contents of the posterior mediastinum. The clinical correlation. The clinical correlation of the general mediastinum include: 1. There is what they call mediastinal syndrome. This mediastinal syndrome it occurs due to the compression of the mediastinum structures, either as the result of a growth in the mediastinum, such as either the tumor or the cyst. It is characterized by many things, such as dyspnea, that is difficult in breathing, which occurs due to the compression of the trachea, or a dysphagia, that is difficult in swallowing, occurs as a result of the compression of the esophagus. There is also hoarseness of the voice due to the compression of the left laryngeal nerve, and there is also the erosion of the thoracic vertebra, which occurs as a result of the compression or pressure on the thoracic vertebra. And this mediastinal syndrome is commonly or majorly caused by bronchogenic carcinoma or the aneurysm of the aorta. Another again is there is mediastinitis. Mediastinitis, from the word nitis, simply means the inflammation, and it occurs as it is the inflammation of the loose areolar tissue of the mediastinum, and it is caused either due to the infections of the neck, which passes or spreads into the mediastinum, either through the pre-tracheal spaces or retropharyngeal space. So the infections of the neck usually goes into the mediastinum and causes the inflammation of the mediastinum. So another one is the mediastinal shift. The mediastinal shift indicates a lung pathology, and a mediastinum can shift to either the affected or the diseased side, as well as it can also shift to the normal side or the healthy side. A mediastinum usually shifts to the affected or the diseased side if there is a decrease in the intrapleural pressure, as in the case of the collapse of the lung, and in the mediastinum can also shift to the healthy side, as in the case of the pneumothorax or hydrothorax. In this case, there is an increase in the intrapressure of the disease side, so the mediastinum shifts to the healthy side, and it is very important because it indicates a lung pathology. Another clinical correlation again is there is an extension of pus from posterior mediastinum to the thigh. So a pus from the posterior mediastinum can reach the thigh at the level of the femoral triangle, because the source sheath, communicates with the posterior mediastinum through one opening, and through that opening, the pus from the posterior mediastinum can travel down into the source sheath, then from there at the level of the femoral triangle, then into the thigh. So there's an extension of a pus from the posterior mediastinum into the thigh through the orifice, which serve as a means of the communication between the source sheath and the posterior mediastinum. This comes to the end of our class on the mediastinum. Kindly subscribe, comment, like, and share. Don't forget to turn on your notification bell so that you don't miss any new video.